So basically, substance use disorders, my topic is related to, the different types of, we have three categories that we'll be looking at. You have stimulants, depressants, and hallucinogens. All of these have some overlapping properties, but there are certain distinguishing features that I want you guys to focus on because it can be very easy to confuse them. So let's just start with a question. Okay. We're gonna start with the let's just see the question and you guys. Okay, so this is the question. You guys can try answering, and then there are like questions in this entire presentation. Okay. And I'll expect you guys to answer some in between, and those that obviously as we go by the end of it, you guys should be able to know the key differences. I haven't covered every drug in detail, mainly the more high yield ones and the ones that we tend to forget or revise. So like if you guys are looking at this in the last maybe 2-3 weeks of your prep, it'll be a good revision for you guys too. So do they want to try this question? Okay, let's see. A, ecstasy. Okay, A. Okay, right. Okay, so actually we will be discussing ecstasy in detail. We will be discussing bath salts. We will discuss cocaine, and I have LSD too in this. Amitriptyline is obviously just an antidepressant. Okay, so here the main thing that you guys have to look at is the temperature, pulse, right? The blood pressure, right? The eyes are dilated. Okay. I want you guys to notice this too. The patient becomes combative and assaults several emergency department staff. Okay. And another very important thing is the timing. 18 hours, and I've never seen her like this before. And I don't think it's lasted this long. So actually, this is actually, I never studied this in step 1. I'm not sure if it's in step 1 now, but this is actually bath salts. Okay. Yes, we'll go into ecstasy obviously in detail later, but some features of bath salts that I'll already tell you about, and we will revise during our slides is that bath salts are stimulants. Okay, so they basically come in like the same category as amphetamines and cocaine. So they do cause hyperthermia, pulse, and hypertension, dilated pupils. These are common things that most of these stimulants cause. The two distinguishing features that I want to tell you in this question are that the length. Okay, so one thing that you guys need to know is that bath salts last a very long time. Their effect is 18 hours, which is a lot. Most of the drugs do not last this long, and these are synthetic drugs, so you guys need to remember that. A lot of questions that I've seen in the the question banks and all, they use just by the length of time. Sometimes they'll even say a couple of days or something like that. That's a very important distinguishing feature of bath salts. And also this, when you become assaultive and combative, that obviously that can happen in a couple of other drugs, but when it's associated with all these symptoms, it is definitely bath salts. But don't worry, I'll get to the slides, and I have I'll revise with you guys the important distinguishing features. We're gonna start with stimulants. Okay, so stimulants are a class of drug. Okay, so what you need to know is that stimulants, right, they increase the activities in the CNS. So why people take stimulants, as you all probably know, Adderall and stuff like that, cocaine and all this, actually, other than obviously causing euphoria and all, they increase your alertness, your attention, and energy levels. Okay. They also increase heart rate, blood pressure, and body temperature. But the reason why they're stimulating drugs is because they increase activity in the CNS. There are other, like even hallucinogens can cause heart rate, blood pressure to rise, but not usually body temperature. That is something specific to stimulants as well. And so basically you have a sense of heightened energy and wakefulness. So we have like about 5 drugs in our syllabus which come under this. And we're gonna start with caffeine. So caffeine intoxication, that's obviously when we have coffee and stuff like that. It's an adenosine antagonist causing increased CMP levels, which causes excitability, catecholamine. So it's a very step one thing, so you don't need to worry about it. So remember that most stimulants, right, they cause psychomotor agitation. You get excited, you can have insomnia, your speech is incoherent, you have a chaotic flow of thoughts, right? Restlessness, tremor. Obviously, you won't see all of these features in questions, but I'm sure the most common ones that you could see is restlessness, you could see tremors, and insomnia. I'd suggest that you need to remember when it comes to caffeine intoxication. Okay. Then after intoxication, so you have to remember it's a stimulant. People use this like, everyone knows you take coffee to stay awake, right? To be alert. So just remember this as one of the first drugs. And obviously, when you have caffeine withdrawal, you get a headache. Always remember, like usually, like for example, when you have a withdrawal from a stimulant, right? So a stimulant causes you to feel extremely active, right? So when you're gonna, like, to generalize it, because the withdrawals are more or less the same, mainly for stimulants, they ask you questions related to the intoxications, and I will give you 1 or 2 specific cases where you need to know that the withdrawal symptoms as well. So you can see the person will be drowsy, have a depressed mood, they'll have fatigue. So yeah, so what happens in withdrawal is that you're gonna get basically the opposite of the stimulating effects. All right. Okay. So now synthetic cathinones. So these were the bath salts that I was talking about. I don't blame you guys if you guys didn't know this, because I never saw this in step 1, right? And I saw this in the step 2 question bank. So these are similar to amphetamines. Okay, so you need to know there's street name bath salts in U world. This is the usual the way they write the option bath salts. So what do? They increase the release and decrease the reuptake of the monoamines, right? So you get norepinephrine, dopamine, serotonin, leading to sympathetic stimulation, and you get hallucinogenic effects. Okay, so what are the symptoms? So as I said, hallucinations, hyperthermia, diaphoresis, mydriasis. So all of these symptoms you are seen with many of the stimulants. Okay, like your methamphetamine, your cocaine can all cause these. Okay, but these 2 that I've used a different size for. The font size is different. These are specific to bath salts. Okay, so and this prolonged effect lasting for days or even weeks. So they have a tough time of getting out of your system. So whenever you need to see the duration of the effect. If it's lasting days or weeks, it's a very high chance it's bath salts and not cocaine or amphetamines. And again, if they're very aggressive, combative, and if they're getting muscle spasms, right? This is definitely it should direct you towards bath salts. Okay. Seizures can happen both in cocaine use and this, but obviously it's a feature of a stimulant. Okay. Am I going at an appropriate pace right now? Is everything good? Let me know if you guys want me to slow down or repeat. Okay. So so this is very high. You know, even during my studies, I used to get confused. So just remember the distinguishing features, because you guys will be able to decipher the questions easier then. Okay, wait. Yeah, okay. I'll take a little slow. So yeah, so bath salts again are stimulants. Stimulants, as I told you, are drugs that increase your activity in the CNS. They make you alert. They make you energetic. They can give you a feeling of grandiosity, right? So we take those to get super active, and when we're gonna get things done, we take such drugs. These effects, hyperthermia, hypertension, diaphoresis, mydriasis, which are actually the sympathetic effects, are common to most stimulants, right? When it comes to bath salts, which are a synthetic form of stimulants, right? They're called synthetic cathinones. The distinguishing features are that they have a prolonged or long-lasting effect. They can the patients tend to be more aggressive, and you can have muscle spasms. So these are 2 or 3 distinguishing features which they will definitely mention in the question. They'll never give you a question with like, these 3 and tell you, which one is it. That would be too difficult to distinguish. Okay. Okay, so I'm gonna go ahead now. So now we're gonna go on to amphetamines. So again, increased release inhibited reuptake. More or less, you don't need to really know the mechanisms for step 2. Remember, they just cause sympathetic stimulation and hallucinogen. Again, diaphoresis, hypertension, tachycardia, increased libido. Okay, so a distinguishing thing in this could be this, especially this, the grinding teeth, which can lead to broken teeth. You can find deterioration of your teeth here. So you can have tooth decay. Okay. It's very specific for amphetamines. And you can also have itching. You can also have itching and cocaine, but this is a way to distinguish with your bath salts. Okay. And again, severe agitation, psychosis, euphoria, more or less, these things are similar. But I want you guys to remember this point, because if it's amphetamines, they will definitely mention this to make it distinguished from the rest. So when you have acute toxicity of your amphetamines, what you do is you give fluid therapy. You have to control the hyperthermia, hypertension, arrhythmias, benzos to treat seizure and agitation. This isn't a very high yield slide, honestly. They don't ask you the treatments are not very high yield for the substance use disorders normally, but I've mentioned some in between just for the sake of it. But you really need to know how to diagnose which drug is causing the effect. So now we've done 3 of the stimulants. The first was caffeine, second was bath salts, and the third was amphetamines. I think we should go on to amphetamine withdrawal. Okay. So withdrawal, this is one of the withdrawals that you guys need to know. Physiologic crash is important. So the main thing in physiologic crash is because amphetamines and also cocaine. So amphetamines and cocaine both give you a very high sense of euphoria. They get you very targeted and stuff. So when you have a withdrawal, what happens is that you have depression, and you have a major type of depression. You get suicidal thoughts. So I've seen some questions where they try to make you distinguish between a person who could have bipolar or is going through like, physiologic crash. Because he's going through physiologic crash, you could get confused that this is just a depressive episode. But remember, the history will point towards somewhere that he has used cocaine, or maybe they'll say he's had multiple depressive episodes, and right now, like, his hypertensive has dilated pupils or something like that. So remember to I think I saw this case in one of the question banks. So it's very important to remember. In bipolar, you won't get any of the sympathetic stimulation or other features. So you need to remember that in both amphetamine and cocaine withdrawal, you can get a physiologic crash in which you have decreased energy, depression, suicidal thoughts, dysphoria, increased appetite, sleep disturbance. It has many of the features of major depressive disorder. And just remember, it's like a severe type of depression, which is due to the withdrawal from the drug. Okay. Okay, so when we go to cocaine, so cocaine specific questions will always, if they're trying to direct you towards cocaine, right? Other than obviously the point that I've stated before, which included the sympathetic stimulating properties, you have these 3. So ACS, chronic nasal ulcer, acute aortic dissection, right? These are more like if a person is coming with chest pain, right? These are more associated with cocaine. right? So obviously, I'm sure there are cases where amphetamine causes this and bath salts cause this, but when it comes to the USMLE exams, like 99% of the time they will give you one of these points, right? Like with stimulants, you have appetite, your appetite decrease. So they can even say that the patient has a history of weight loss even, right? So you need to remember these things that are associated with cocaine specifically and bath salt specifically. Don't worry, I have a summary slide later. So this is our last stimulant, okay? So tobacco use, obviously it stimulates the nicotinic receptors in the autonomic ganglia, causing both sympathetic and parasympathetic stimulation. You get tachycardic, mild hypertension, you can have weight loss, restlessness, anxiety, insomnia, increased GI motility. I've never really seen many questions on this tobacco use, honestly. But for the sake of completion, it's like the last stimulant. So we should mention it here. And yeah, so this is stuff that was tested more in step 1, but I have put it here again. So remember that when we're treating we're trying to treat someone's tobacco use, right? So we use these drugs. We can use varenicline, we can use bupropion, we can use nicotine. So what you need to remember is that varenicline reduces the positive symptoms and prevents withdrawal, okay? And bupropion reduces the craving and withdrawal, okay? And nicotine replacement therapy is also another source of improvement. When you get withdrawal, you can have, again, you can have, okay, so insomnia, it was in both cases, right? Not very high yield to know. I just did it for the sake of irritability, frustration, anger, restlessness, increased appetite and weight gain. Obviously, you can have decreased appetite when you're using it. So when you're not using it, you get increased appetite. So tobacco, I wouldn't say is very high yield. The high yield ones, again, cocaine, amphetamine, and bath salts. These three are very important to distinguish. Remember this, urine drug screen is the best initial test for evaluation someone who has potential cocaine or amphetamine intoxication or overdose. Another important thing, synthetic cathinones or your bath salts cannot be detected. This is also another thing that I've seen in questions. If they haven't given you, any distinguishing feature, and it's like, is it cocaine, amphetamine, or is it synthetic cathinones? But they've given that the urine drug screen is negative, pick bath salts, because bath salts are not detected on your urine drug screen. That is very high yield to know. Okay, so remember that. Okay. Is the pace better now, or do you want me to still slow down a bit? Okay, it's perfect. Okay. Okay, that's good. So remember that. I think the next slide should be the summary slide. Okay, yeah. Okay, so before that, cocaine intoxication, one thing I wanted to remind you guys is, obviously, the person is extremely stimulated. You try to sedate him using benzos, but the hypertension control, you need to use non-selective alpha and beta, because obviously if you're using selective beta adrenergic blockers, they're controversial because they can cause unopposed alpha stimulation. And when you have unopposed alpha stimulation, your hypertension shoots like anything. Okay, so you get increased blood pressure and you can't have that. So remember that you have to give non-selective ones which affect both alpha and beta. Okay, right. Okay, so this is the most important side. Cocaine, amphetamine, bath salts, they are stimulants, right? They increase, obviously, your CNS activity. Okay. And they increase your sympathetic activity. Hypertension, tachycardia, dilated pupils is common to all three. So what are the differences that you need to remember? Tooth decay and coriform movements. I'd suggest you lean towards methamphetamine. Okay. Seizures, chest pain, chronic nasal ulcers, aortic dissection will have chest pain. Your ACS will have chest pain, lean towards cocaine. Okay, if it's a long-lasting offense, not detected in urine, bath salts, and remember spasms and aggression, right? So this is a very important high yield slide. Don't worry, our slides will be available after the presentation is over. But is everyone good with the differences in the three now? Because remember, they won't ever give you, clear cut that. They will always give you, overlapping. I've seen questions with all three as options, but if you remember these differences, you'll definitely see in one of them. Yeah, or you could see chronic nasal ulcers, or maybe they'll say that it's been like, a day and it hasn't gotten better, something like that. Okay, so these are the stimulants. Again, tobacco, I wouldn't say is extremely high yield, just put it for the sake of completion. And caffeine, again, sake of completion. These three, I'd say, are more high yield. Okay, but again, at the end of the day, they're on your syllabus, so it's good to revise. Okay. Okay, again, physiologic crash. I just wanted to reiterate how important it is. Fatigue, exhaustion. Individuals will have extreme tiredness and lack of energy, depression, feeling of sadness, hopelessness are common during the withdrawal period. You can have increased appetite. You can be restless and irritable as well. Remember that distinguish bipolar from any physiological crash, right, is very important. Just see if that person is not using, and they won't even give you like cocaine use as an option. They'll write something like, is it bipolar or is it substance use disorder, right? So you have to remember that. Okay. Okay, now we're gonna jump from stimulus to hallucinogens. So remember, I told you stimulants increase the CNS activity. So hallucinogens also have activity which can increase the sympathetic symptom, but symptoms. But hallucinogens are basically, as the name suggests, they cause hallucinations more commonly. They impair your perception of time and space and stuff like that. So that is what hallucinogens do. So although these class can cause tachycardia, hypertension, and mydriasis, their difference lie in the concomitant symptoms. Stimulants cause increased energy, concentration, grandiosity, hyperthermia. Hallucinogens can cause perceptual distress, where they can cause flashbacks, conjunctival injection, dry mouth. Obviously, these are distinguishing features of different drugs, which we will discuss. But just letting you know that, like, don't be surprised if you see, like, someone using LSD who is getting tachycardic, or someone who's using maybe PCP and getting hyper attention or something like that. So that portion. Remember that stimulants are not called stimulants because of only the increased sympathetic activity. It's because of their effect on the CNS. They stimulate your mind. Okay. So now we're going to go on to the hallucinogens. So one of the first hallucinogens is cannabis. Cannabis sometimes is classified as hallucinogen. Sometimes I've seen it's not, but I've put it here. So as you all know, it's marijuana, dried leaves. You need to remember this, some facts of I wouldn't say the withdrawal and intoxication aren't high yield, but cannabis has, I've seen different types of question on it. So this is a very high yield thing to remember, that dronabinol, which is medical marijuana, is used to increase appetite and treat nausea and vomiting in terminally ill patients. So those undergoing chemotherapy and in patients with AIDS, they're cachectic, they don't want to eat, you need to stimulate their appetite, so we give them dronabinol, which is medical marijuana. It can also relieve pain in cancer patients and reduce IOP in individuals with glaucoma. So these two I've seen tested in the question banks, definitely, but I've never seen this third point, but for the sake of it, it's good to know. Okay, so intoxication. So as you know, it causes euphoria. You get feelings of intense happiness or pleasure. You get perceptual disturbances, a distorted sense of time. Time may seem to be passing faster or slower, impaired reaction time, coordination, motor coordination, right? You get socially detached, and you have impaired judgment. So not very specific features right now, but the next slide, I want you guys to remember. So most commonly seen in the question stems of the question banks are these. So at least two of the following symptoms must be present within 2 hours after cannabis consumption. So tachycardia, conjunctival injection, increased appetite, dry mouth. So I've usually seen dry mouth or almost and conjunctival. One of these will always be mentioned 90% of the time in the question. So just remember these two. And otherwise, you guys are good to go. Okay. So just remember that. And yeah, it increases appetite. Just remember that. So dronabinol, we use it. Remember that. Okay. Withdrawal, not very high yield. You just get depressed, decreased appetite, restless, sleepless. I haven't really seen many questions on this in the question bank. So like, yeah, okay. So these two are very high yield cannabis disorders. So you have cannabis induced psychosis and cannabinoid hyperemesis syndrome. So what happens in cannabis induced psychosis is that it is characterized by the onset or worsening of psychotic symptoms such as hallucinations, delusions, disorganized thinking, and impaired cognition following cannabis use. So it's important to know that not everyone who uses cannabis will get these symptoms, but it is possible. In some cases, you'll have a history of psych illness in the family, right? Or you could, you're prone to developing schizophrenia too. So these patients usually do have cannabis-induced psychosis. Just to remember that cannabinoid hyperemesis syndrome. So this is a condition which is associated with long-term heavy cannabis use. So a person who's using a lot of cannabis, has been using for a long time, can get recurrence episodes of abdominal pain, nausea, and vomiting. The exact mechanism is not very important to know. But this is a very distinguishing point that temporary relief can be found through exposure to hot water. It's a very odd point, but it is, remember, so someone who is vomiting and, there is someone who smokes pot, like who is using marijuana, and a weird question stem might say something like, there's some relief with exposure to water. So the main treatment is to completely stop cessation, stop use of cannabis. But so yeah, so these are two diseases that you guys should remember. I've seen them in question banks. Okay. So, okay. PCP versus stimulants. So PCP, if some of the symptoms are ahead, I want you guys just to remember that PCP can also cause hypertension, can also cause tachycardia. One important thing that you guys need to know is that patients are characteristically agitated to the point of being violent. So technically they can be compatible, but they have nystagmus with mid-sized or constricted pupils. They will not have dilated pupils. This does not cause mydriasis. And nystagmus, I've seen in almost every question where there's been nystagmus, PCP was usually the answer. Obviously with tachycardia, hypertension, all. So remember that. So nystagmus is extremely high yield to know, and remember it does not cause mydriasis. Okay, so this is a distinguishing feature of PCP versus the stimulants, and PCP is just a hallucinogen. So yeah, which intoxication is this? This is just PCP. So remember, nystagmus, very important, horizontal or vertical, violent dissociation, hallucinations, amnesia, ataxia. But this is a very distinguishing one. Remember, it can also cause high blood pressure and tachycardia. Okay. Okay, you guys can try this question. we did, there's something you other probably studied, LSD. Okay. Yeah, okay. Yeah. So yeah, you're right, Osama, you're right. This is LSD. So one important thing of LSD is that this line, she also made flowers at the tea, right? And that she could hear the colors. So yeah, whenever someone says they can hear colors or visualize sounds, that's a very like that straight up, that's always LSD. So LSD is here. Very important to know that. It's also a hallucinogen. LSD is one of those rare ones that has usually like no withdrawal symptoms. Okay, it does cause flashbacks, and flashbacks are like just you get like an episode of it of the hallucinations like months after you've stopped using it. So it can happen at any time. So that's a weird fact to know about acid. And another thing that you guys need to know is that, yes, as I said, look at the person is tachycardic, hypertension, dilated pupils, right? So these aren't like, obviously the blood pressure is not as high as you'd see in like, the stimulants, which increase sympathetic activity a lot. But I wouldn't say like, guaranteed they could, you don't know how they're going to test you. So, but usually, yeah, the stimulants do increase the blood pressure and pulse to higher levels than this. But again, in this question, you can see all of these, but you'd always be able to distinguish with one or two lines. Okay. So now the last hallucinogen is MDMA. Okay, so MDMA causes hallucinations. So it has some distinguishing features here that it increases secretion of the antidiuretic hormone, which can cause thirst. Increased water intake without electrolyte can cause hyponatremia. So MDMA has some very specific features that you need to remember. And I have summarized them here. Okay, so you have grinding threat, bruxism, you have hyponatremia with increased risk of seizure, life-threatening cerebral and pulmonary edema, perceptive changes, cold extremities, hyperthermia, and if it's severe, it can cause Rotten syndrome. So like features to remember are this. Hyponatremic bruxism is extremely important too. And remember, it causes extreme hallucinations. Okay, so remember in the question, they obviously there are a lot of overlap between drugs, but they will definitely give you 1 or 2 points that, if you remember, will be definitely distinguishing between them. Okay, so this is another question. A 24-year-old brought to the ED. He can see fire moving through the air, that sounds appear brighter. So again, so this is another question. There's also LSD. Okay. Again, pulse isn't too high, but like blood pressure is 140/80, right? Mild pupillary dilation, urine tox is negative. So this is LSD too. So LSD features, the main feature that I wanted you guys to discuss. I don't have a separate slide of it, but is that like, they usually mention something. It's called, I think it's called synesthesia. When you can do this. Okay. This is a long question. We'll just. Okay, yeah, you guys can try this. I haven't given options in this, but like, sure. Oh, I guess the main question would start somewhere from here. Okay, let's see. We got 2 replies. Methamphetamine. Oh, yeah, brilliant. Okay, yeah. So this is methamphetamine. Yeah. Okay, so again, I remember hyperthermia, I would say, is not found in like, other drugs I've seen. I'm like hyperthermia is very common in, cocaine, amphetamines, and these 3 stimulants usually. And that's all right. So it's you can see the blood pressure is raised and severe tooth damage, also multiple excoriation. I think I mentioned this too, itching, which can be also found in cocaine use, yes, but is more associated with amphetamines. Okay, and the pulse was also very high. So good job. This was amphetamines. Okay, so now we're gonna go on to the depressants. So the CNS depressants, obviously, they basically cause you to slow down. You can get ataxic, you can get like slow reaction time, and we'll cover three main depressants, I believe, in this. So opioid is your first. So this is the classic triad that you can find in most questions: altered mental status, bilateral meiosis, pinpoint pupils, and opioid-induced respiratory depression. Okay, so this is like usually they give you an RR something like 6, and they'll say pinpoint pupils, so that the brain goes straight to opioid use. Although in most questions I've seen, when it's opioid use, they will give you these. Sometimes it's not always necessary. So these are other features that you guys need to know. It can cause constipation, decreased bowel sounds, bradycardia, hypotension, pruritus, hypothermia. Just for the sake of a completion, I've added the other ones, but the first slide actually mentions the major depressive effects. Okay, so 1 second. Yeah, this is a slide I want to. So opioid intoxication and absence of meiosis does not rule out opioid intoxication, since hypoxia and co-ingestion of other illicit drugs like cocaine, amphetamines, or medication like atropine, dextromethorphan can cause mydriasis. So I hope they never test you like this, but just remember that just because the person does not have, if they've taken multiple, I think this is more of a clinical point. I've never seen this tested in a question, but if you have like, normal pupils, it could be because the person did take opioid, but at the same time took something that's causing mydriasis. So the overall effect is that, the eyes are not myotic. Remember that heroin can be smoked, snorted, or injected. So if you have absence of trace marks on the neck, remember that you can have opioid intoxication due to smoking or snorting heroin as well. Okay, these are just points to remember. I don't think I've ever seen them tested in a very difficult way, but for the sake of completion, I told you guys this. Opioid withdrawal is very easy to actually see. It has very distinguished. If you have flu-like symptoms, rhinorrhea, chills, you get tachycardia, hypertension, mydriasis, you can get hyperreflexia, nausea, vomiting, diarrhea, and insomnia, irritability, damp skin, piloerection. So the treatment of opioid withdrawal is buprenorphine with naloxone or methadone. I have some slides on the treatment. So the treatments I want to talk about are naloxone, naltrexone, and methadone. I used to get confused between these sometimes, but so just for the sake of them being put together, you guys can distinguish it. Just remember, naloxone is usually the immediate treatment we have to give when we're just suspecting, an opioid overdose or a person's intoxicated. So it has a very rapid onset, 2 to 3 minutes. So it's the treatment of choice. It neutralizes the effects of opioids and restores the respiration and counteracts the CNS depression. The drug should be administered slowly to prevent acute withdrawal syndrome. Remember that. Okay. And because it has a dose-dependent duration that is shorter, you need to give repeat administration, right? So following detoxification, that's when we use naltrexone, right? So naltrexone is used for preventing relapse of opioid dependence. Okay, the immediate treatment will be naloxone to cause the CNS depression to go away, right? And then naltrexone is the receptor antagonist, which can reverse the effects of opioids, but it's not used for acute intoxication because it has a relatively slow onset of action, only 1 to 2 hours. Right, slow, and its long-acting properties, it is used to prevent opioid use by reducing its euphoric effects after acute detoxification. So first step would be used to naloxone once the person is stabilized and obviously they want to quit using opioids, we give them naltrexone. Methadone is not used for opioid intoxication. Remember that it is contraindicated. It is used for symptoms of opioid withdrawal. Okay, so remember that. So now, whenever we're talking about intoxication, these two drugs should come to mind. When we're talking about withdrawal, we got methadone. Okay, so you guys can try this question. Okay. C, methadone. Yeah, you're right, definitely. So yeah, so this is a withdrawal question. Remember, in withdrawal, we give methadone, right? And if it's intoxication and we want to treat it, we give naloxone and naltrexone. Good. Just a quick reminder, even though this is a hallucinogen, not a depressant. This is well, you guys don't have to answer. I'm sure you guys know. This is cannabis, right? So you have your dry mouth, you have your conjunctival injection, very specific. Okay, so inhalants are something that I've seen tested on like, you know, your NBMEs and now also in step 2 UWorld and other question banks. So what you need to remember, it is most prevalent in your high school age individuals. Usually they give you like a 16 something or 18-year-old boy or girl, and they work by depressing the CNS. Very high yield to know. This is usually the clue they give. Blue sniffers rash, which is a eczematous rash between the nose and the upper lip. So lingering odor of the inhalant use. It has okay. So when you do these questions, so inhalants have multiple uses, right? Multiple features in intoxication. They go on nystagmus, tremor, dizziness, confusion, diplopia, headache, hallucinations, gait disturbance. But usually they will give you the rash, and you can see the age, and you can see they'll give you some of these symptoms along with it. Intubation is only necessary, obviously, if the person is not able, if it's so respiratory distress that they cannot breathe on their own and they need to be intubated. Our last depressant is alcohol. I haven't really mentioned alcohol in extreme detail because honestly, it could have at least, 6 to 8 slides on its own. But I have mentioned, so when you are intoxicated with alcohol, you will have disinhibition, nausea, vomiting, dysarthria, ataxia, blackouts, stupor, coma. I haven't really seen many questions where they've given alcohol intoxication as that, but the withdrawal is much more important. Right, so the withdrawal, I'm sure you guys have read the withdrawal in detail as well. Yeah, so the withdrawal syndrome starts in 6 to 24 hours. So in this case, what happens is that you are normally just like, your sympathetic activity goes up. You can have tremors, you can be anxious, right? You can be tachycardic. 12 to 48 hours, you can have seizures and hallucinosis. Seizures, obviously, the patient will be seizing, so not much to describe there. In hallucinosis, one important thing is you can have actually any type of hallucination, but remember that usually your vital signs can be normal in this case, right? Vital signs can be normal. Delirium tremens is the worst case. It happens 72 to 96 hours after. And remember, in delirium tremens, you are no longer oriented to person, place, or time, and it is a very, serious. It's the 4th stage, and it's very dangerous for withdrawal. And I'd suggest, obviously, do read alcohol intoxication withdrawal a little more in detail, but this is the gist of it. So basically, we've covered most of the drugs. This is actually the end of the presentation. I'll just, we can have any question. 1 second.